Take back control. Stop letting algorithms decide your news. Get uncensored history and real knowledge to strengthen your mind, body, and spirit. Watch ad-free content now at ineverknewtv.com premium. All right, I want to say welcome to Dr. Isuo.
Yes, sir.
Maurice Isuo, coming straight from Texas, from the Innate Touch Chiropractic. Mansfield, Texas. What's going on?
Man, doing well. Blessed to be here. First time in Philly, so...
Serious thing. Glad to have you here. We're going to get right into it, right? And the question I have for you is, what do you think is the biggest misconception people have about chiropractic work?
Okay, I would say, just ill-informed, man. Ill-informed is really what it is. The misconception, if I could just bundle it up, would be most likely that they think that it's just for, oh, I have a headache, or I have some type of, oh, I slept wrong. Can you just crack me up real quick and I'll be on my way? My low back is bothering me. Can you just give it a little crack and I'm good to go? I think that's the misconception, is that they view chiropractic in that way. And, society and, the administration, the medical models really push that for people to think that way about chiropractic. But truly, chiropractic is, for me, I believe it's the primary care for the human physiology. There's nothing that is more superior in a healing modality.
Explain.
So allopathically, if you look at the way that they approach the body, it's a outside-in approach, which means that, okay, you're having a headache, let's go from the outside and try to put it inside your body to heal it. Let's give you this Advil, all right? You're having some type of gut issue. Okay, let's give you this nausea medicine, but wait, that nausea medicine needs this in order so you don't have headaches later. And then you be constipated. So they're giving you all these outside approaches to heal you inside, where the philosophy of human is first that we come from above. So that means that the source, God, whatever you believe, comes down into you. Inside your body, it operates. And then the last thing is it expresses out. So if you look at somebody's skin, if they have a lot of rashes or they have a lot of acne, that means that there's something going on with their gut, the inside. The last thing it shows is the outside. So the skin is actually showing the least damage of what's going on in your body. So you have a couple pimples, you just think, oh man, I got acne, but you got to understand that it's worse going inside the body because the skin's the last, it's like this layers pushing out. And so whenever you're dealing with chiropractic, we are adjusting so very close to the spine that it's the closest that you can get to the nerve impulse before you start jumping into the world of metaphysics, where they haven't really dove into or understand that. Now it's all woo-woo and magical, right? But just scientifically, they have shown a lot of research. One where the technique that I do is it's called Hand Alchemy, right? And so this is a above, down, inside, out approach. What we do is we analyze based off of the skull on spine relationship. So what that means is how your head is sitting on your neck. Right, the first neck is called the Atlas. Atlas is what holds the world, right? If you look in Greek mythology, he's like holding the world, and the world is essentially your brain, is your world. That's how you process all information, and then how the body functions from that. So if you're looking at that and you're seeing that there's some type of tilt going on in the head, that you know that the rest of the body has to adapt to that tilt, because that's what's processing the information. So if it's tilting here, okay, well, guess what? We're going to have to make sure that your eyes are level with the horizon. So that means that we're going to slide the head forward. So then now it looks like it's a little bit easier, right? But then when that happens, the shoulders have to compensate and roll in too, because all of the front parts of the necks are pulling it forward, which is weakening everything in the back, right? So they say it's like upper cross syndrome. Let's just put you in some physical therapy. Okay. I feel like every profession, massage, physical therapy, whatever, they have their niche, and their needs. I feel like everything is essential for whenever it's needed for that thing. But with chiropractic, it's such a powerful thing, because whenever you can change how the brain is processing the information, you can return change what's going on in the whole body, right? So that's the only profession where you can take that and shift that joint, right? Shift it fix the positioning of where it's at, because just a micro tuning of the system creates such a dynamic change in the body. And so, for instance, whenever you are working with the spine, let's say that you are adjusting, someone's having like a little cough or some phlegm or some buildup. There's a segment in the spine, the thoracic, there's 12 segments. If you go to the fourth segment, that the nerves that run from that fourth segment stimulate the thyroid, right? The thyroid has ability to build these T helper cells that start going around the body, and they start to build these cells to attack certain like macrophages, monocytes. These are different things that attack bacteria and viruses in the body, or at least help. That's the goal. And so that's just one segment of what can happen. All right, if someone, one research that we did was on the effect of frozen shoulders. So that's adhesive capsulitis. What that means is whenever somebody is trying to abduct, which means that they are trying to raise their arm from this lateral plane here, there's 180 degrees of motion in abduction. The first 120 is done by the deltoid muscle lifting it up. The other 60 is done by the scapula retracting and going down so that the rest of the arm can move up. Well, what they've noticed is that when people have these frozen shoulders, usually roughly around the ages of 30 to 55 years old, that these people, they think that it's a torn rotator cuff or some type of old injury. So what they do is they put them through physical therapy, right? Because that's also part of the allopathic bundle. You do the physical therapy, they get you on some pain pills if needed, right? And then if that doesn't work, then they're going in and they're going to do cortisone shots. They're going to inject it. And then you come back later, it wears off, it still is in discomfort. Then they do manipulation under anesthesia, which is like $12,000 a pop. And pretty much they just put you to sleep and just force your arm up. All right, you come back, arm still isn't working right. So then that's when they go and they do reconstructive surgery with exploration, which means that if they go in there and they cut you open and they find some other issue, you've signed the right for them to go in there and fix that without your consent either. So I think your bicep tendon's messed up too. We'll just do surgery on that as well. All right, so that's pretty much all they can do. That's the limitation of the allopathic model when your body is in disarray, or what I like to call it is in trauma. It's in a subluxation. Subluxation in the Greek word means sub means less than, lux means light. All right, so in that area, all that is missing is some type of chi, some type of input that's causing these symptomologies, that's causing your body dysfunction. That's my philosophy behind it. From the above down, we're light, we're energy is moving through us. We're just a structure, you know? So when these people have this frozen shoulder, what we realize is that it's actually a dysfunction in the occiput, which is to this day is the very specific, most important thing that you can adjust on somebody, because that's what's carrying the brain. And there's 12 cranial nerves that run from the brain that are very, very valuable to the body. One of them being the vagus nerve, which stems from vagabond. That means that they just walk around. It's a wanderer, right? So the vagus nerve is the same thing with your organs. It innervates every single organ in the body, literally. So what shares the same conduit or the same foramen, the same hole as that, the vagus nerve comes from the brain. It's a cranial nerve, and it goes down into the body, but it has to go through a hole because of the skull. It's all encapsulated in the bone. As that goes down, it shares the same conduit, another nerve goes down with it, the spinal accessory nerve, which is spinal nerve 11. Vagus nerve is spinal nerve 10. Okay, so the spinal accessory nerve innervates the SCM, which is, they say it's a neck flexor, but it doesn't touch any bone in the neck. So that's crazy. But really what it's made is to help modulate your head. You know, it's a primary rotator. So with your primal movements, if you are going to like grab something and bring it towards your face, the SCM is going to activate it to make sure that your head is able to turn and do that motion efficiently. That's pretty much the main thing, but also keeps your head level with the horizon.